So I have recommended a penile implant as a definitive treatment option for erectile dysfunction, usually because you've either tried and failed other treatment options which maybe weren't as effective as you would have liked, or there's underlying pathology or a disease state that does not make you a candidate for one of those other treatment options. So for the procedure, you'll come to one of our surgery centers. This is a same-day procedure, so you'll be going home the same day. You'll be brought back to the operating room, get a chance to meet our lovely staff. Our anesthesia colleagues will safely put you to sleep, and we begin the roughly 45-minute procedure. Usually it's about a 1-inch incision above the base of the penis or vertically at the top of the scrotum. Through that incision, I will place customized balloons inside of the penis, a small reservoir either in the pelvis or underneath the abdominal muscle, as well as a small pump in the scrotum, which will be the only part that you interact with. This allows you to cycle the device. So in my practice, the majority of these implants are completed as a same-day surgery. You'll come to the surgery center, we'll perform the procedure, and patients will generally be observed for 1 to maybe 2 hours after the procedure. If there's a compelling reason to do it at the hospital, such as comorbid medical conditions or a reason to observe you overnight, then most patients will be discharged the following morning. So a penile implant is a purely elective procedure. Erectile dysfunction is a risk factor for cardiovascular disease, so therefore we require a cardiac clearance on all patients undergoing a penile implant, and certainly we can help you obtain this prior to the surgery. Some patients with other medical conditions may require additional clearances, such as from pulmonology, nephrology, or a medical doctor. Yes, all patients will need transportation on the day of surgery. You will be placed under general anesthesia in most cases for this procedure, so it would not be safe for you to drive yourself home afterwards. So yes, we do ask all patients to arrange for transportation both to and from the procedure. So when we schedule patients for a penile implant, you'll be given a checklist with clear instructions on what to do prior to the procedure. I will usually meet patients again a week prior to the procedure to again go over this checklist and make sure that we've dotted our I's and crossed our T's to make sure that you have a successful surgery. We want to check a hemoglobin A1C, especially in diabetics, to make sure that blood sugars are under control. We'll verify that you've had a cardiac or a medical or other clearance if required. I also ask patients to do an antibiotic wash for 3 days prior to the procedure. I ask all patients to use a vacuum erection device to improve the length and health and vitality of the penis and allow for a successful surgery. So at the 1-week preoperative visit, we'll review all of your home medications. In general, patients should stop any blood thinning medications prior to the procedure, and this will usually be clearly instructed by the cardiologist during the cardiac clearance. So in order to put you to sleep for surgery, anesthesia requires that the patient generally have an empty stomach to reduce the risk of throwing up or having any breathing issues. So therefore we ask patients not to eat or drink anything starting at midnight prior to the surgery. So on the day of surgery, it's helpful to bring with you some tight-fitting underwear or a jock strap to provide some support for the ride home. Also, some extra ice packs may be helpful. It's all about preventing swelling after surgery. That speeds the recovery for patients and gets you to using the implant sooner. So you do not need to shave prior to the surgery. Research has shown that if patients shave themselves, it may slightly increase the rate of infection with these penile implants. We don't want any open sores that could attract bacteria, so our surgical staff will shave you at the time of procedure. You do not need to worry about shaving prior to the surgery. So on the day of surgery, you'll come to one of our ambulatory surgery centers. You'll be greeted by a staff in the front. They'll bring you back to the preoperative area where we have an awesome team of pre-op nurses. They will place an IV so that we can give you medications. You'll also have a chance to meet with the anesthesia staff, which will discuss, anesthesia and that whole process. I will meet with you to answer any last questions that you might have, and we go over any paperwork that's required. At that point, you'll be brought back to the operating room where we'll begin the procedure. And after the procedure is completed, then you'll be brought to our recovery area where, again, we have an awesome team of recovery nurses which will manage any issues that you're having in terms of pain. That's where you'll be able to eat for the first time. And then your family will be brought back to the recovery area so we can sit down and talk about the procedure and how everything went. So I think it's natural to be nervous prior to any surgery. What I tell my patients is that I'm a high volume penile implant surgeon. This is one of the surgeries that I'm most interested in and I'm commonly performing. You're also coming to a very high volume surgery center that's accustomed to taking care of these types of patients and these types of surgical issues. Also, by this time, we've met several times, had a chance to go through what the various treatment options are, and we're firmly landed on deciding on this as a treatment option. We've also done everything we could to minimize any risk factors and optimize you for the surgery. So hopefully all of these things will minimize any nervousness that you have prior to the procedure. So if you have any questions prior to the surgery, we are always available to answer those questions. I can be accessed directly through my staff or via our portal. I have an awesome team, including Wilta, as well as Lacey, who often work with me to help patients get ready for surgery.